Hi, Charlene. Everyone should be coming in shortly.
Awesome.
See. I just got another email. Looks like they were having a hard time coming in, but they have to wait till we actually start. There we go. Hello. Perfect.
Stephanie, you want to be on mute, I guess?
Yes, I can stay on mute, and I can take off my video when we start.
Okay, we're happy to have you though with us for now.
Yes. Hi, Luis.
Hola, Luis, ¿cómo estás?
Good morning, bien, buenos días.
Buenos
Hi,
días.
everyone.
Buenos días. And
Hello,
hi,
do I have audio now?
you do. And would you do me a favor and pronounce your name for me?
Anixa Carmona.
Anixa Carmona. Okay, so really just like it looks. Thank you, Anixa. You have such an unusual and pretty name. I didn't want to say it wrong.
Oh, thank you. My mom made it up, so.
There you go. Stephanie, do you have any sense of the order in which I should be having people speak?
No, I think just the way that you sent out the schedule is fine.
Is it?
Yeah, Cheryl didn't mention any specific order.
All right. I mean, I literally just used her order, which is technically alphabetical, if that's okay with everybody. So Anixa, you would be second, Colleen would be first, followed by Nicole and Liz.
Perfect.
Sorry, I had muted myself. Yeah, okay, that sounds good.
Okay. And Luis, I have a quick question for you. Before, are you getting set up with Stephanie?
I think so. So, Stephanie, can you test it out the interpretation feature, please?
Sure. So I will hit interpretation and then let's see. Hi, Colleen. Oh, you're on mute. There's Cheryl.
Sorry about that. My link wasn't working well.
No worries. Glad you're in now. Thank you.
Good morning, everybody.
Hi, Cheryl. How are you?
I'm ready to rock and roll.
Oh,
We
good.
got a great team and good to see you, Anixa and Colleen, Luis, and Stephanie. It's always good to have you in the wind beneath my wings. So thank you for being there.
Of course. Cheryl, just so you know, Luis and I are just going to test out the interpretation now that he's on. So just give us a minute.
Okey doke.
Cheryl, while they're doing that, I'm just gonna briefly say, my plan is to just open and then introduce Luis and then come back and give you a minute. Does that still sound good?
1 minute's what you gave me and 1 minute's what I planned. I take direction well.
You can have more than 1 minute.
No, I want panelists and I hope we get lots of questions.
Okay, and I think in a conference, Cheryl, the expectation is we would start right on time. Okay,
Absolutely,
okay.
absolutely.
So we don't do any of this waiting for people to log in, I don't think.
Other than our panelists.
Yes, that's ideal.
How are you ladies? How's business in the trenches? Crazy as ever?
No pun intended.
Yeah, exactly, exactly.
Yeah, we're in the middle of an audit, so I just finished an audit session, so no fun.
Financial audit or kind of a clinical audit?
A
Medical rec-
Medi-Cal audit.
Oh.
Yeah.
I feel the pain, and I did 39 years in hospital administration, so I love the unannounced ones too, are real special. We used to always get Joint Commission coming on the Wednesday, Thursday, Friday before the weekend because they like to come to San Francisco, so they could stay overnight in the city. Or typically they would do Thursday, Friday, Monday, so they had an excuse to stay over the weekend in the city. So, yeah,
We have a couple more panelists, right?
we do.
But
Okay.
they're not technically due until 10:45, so we're not gonna,
Oh, okay. Oh, good. I wasn't really late.
you are all timely and early.
Okay.
I feel really badly. I haven't even checked in on many of the other sessions. It's been so crazy. I think I had 4 board meetings yesterday. It was kind of silliness. Yeah,
Goodness.
yeah, but
Cheryl, I have a quick question for you.
mhm.
Is there any sense that, no, question back up. This panel is about mental health in general, not focused towards youth, correct?
Correct. I mean, our commission look at women and girls, so certainly we care about the whole community, but it's focused on all ages of girls and women.
Okay, but is it okay if we ask some questions that may relate to getting services for youth?
Oh, absolutely. I would think, I haven't seen the profile of all of the attendees, and I don't know how many will join our session, but I think there's well over 250 or 270 folks. Oh, forgive me. Excuse me for a second. My door rang. My husband can't get up. He has a broken leg.
Stephanie, did Cheryl say there's 270 signed up for this session alone?
Let me see. I'm on the WOVA.
You have a minute now?
Let me just see how many are in this specific. Well, there's 280 attendees total for the conference. That's a 2-day conference. And then we have a good handful of folks who are going to attend this session. And then if they don't have it on their agenda yet, they're able to just hop on right at 11.
Okay, great.
And so far, Charlene, we do not have any additional questions that have come in besides the ones I sent you earlier.
Great. Well, I've got 12 more. I don't think we'll get there, but we have lots. Thank you for sending those, Stephanie.
Okay, you're welcome.
And Luis got a nice compliment today. I got a request from Dr. Ross Green, international clinical psychologist, who wanted his contact information. You're going to be famous, Luis.
Yeah. Stick with Charlene. You're going to go places. How was your session yesterday? Was it yesterday? No, Tuesday.
Tuesday, and we have another one tonight.
Hmm. But you've got you've got the routine down.
We do. We have 400 registered for tonight.
Great.
Digital parenting in a digital age.
That's a hot one. Oh, I forgot to change my glass. That's a hot one. Oh, here we go. Hi, Liz. How are you?
Good morning, I'm well. How about you?
Good, good. Anixa, you didn't get the chance to meet the panel, so she's here, but yeah, Colleen is with the county access to care, and Liz is with One Life Counseling. And the only person missing is Nicole Ibarra from Kaiser.
Nice to meet everyone.
Anixa, when I introduced you, do I say Sutter Health Mills Peninsula? Is that correct?
That is correct. Sutter Hills Mills Peninsula Medical Center.
Okay. Get this all right.
Now, Charlene, we've been on a lot of calls before, and I'm always in the dining room. So you see the backdrop of my dining room, but my husband let me use his office today for this. So this is big time,
You look awesome.
Yeah, yeah. He's got more expletive deleted stuff in this place than I want to even think about, but.
Cheryl, the quick question. We assume that we're just going to go down the list in the order that you sent folks, unless you have a different preference.
I don't. I think I put them alphabetically because I wanted to be a equal opportunity appreciator and not look like I had favorites of any kind. So I just went with the alphabet.
Okay, then that's what we will do. So Colleen, that puts you in first position.
Great.
Or Anixa.
Well,
Anixa.
That's true. We were going with last names. First names.
Oh,
would be
I'm sorry.
Anixa.
I'm sorry. Last names are good.
Of course, Liz, you could have been C or W. We did you as W.
C, but however is fine.
All right. Well, then you'll be the most important one because you're fourth.
So Stephanie, we shouldn't talk about our personal life, but wasn't yesterday's meeting a piece of the work? We'll debrief that.
Yeah, one for the books for sure in the past almost 5 years.
Was it a crazy board meeting?
It's always organized, and we put a lot of energy into the timing and the information. And I don't know what it is about public officials. Colleen, you work with a lot of public officials. Ours are elected officials, but they just decide that their due diligence, you never know what question they're going to ask. They kind of, you call them up and do you understand this? And do you have any questions about that? And is there any more information you'd like to have on that topic? So that you can really have a productive discussion. And then things just kind of come out of the air, like, or something about, not to be silly, but a program we've been working on for 5 years, and somebody will ask a basic question like, what are the components of that program again? That didn't happen last night. But anyway, now we have Nicole. Hail, hail.
Hi, everybody.
Hi, Nicole.
Hello.
You have a stunning background.
Oh, thank you. It's real. I'm right in front of the building.
You could turn around and take that picture, huh?
Exactly.
Well,
I need to work on getting one of my backgrounds like that. I usually use Teams, so I don't have all my.
So do we. Yeah.
Yeah.
I'm in my office, but I've heard people say they think it's a fake background too.
Well, I don't have a good enough camera. I have to get a better quality camera because no matter what one, we have ones for Rise. We have a whole series that we could use as our backdrops. But if you move it all, your head falls into a black hole.
Right.
And
Yeah.
sometimes I feel like I've got a blank hole for a head, but I don't want to kind of advertise it in the program. So you're sitting there like this and that looks silly. So, and I've got a little Italian in me, so I don't talk sitting still. Gotta move. And
Yeah, I saved one of those backgrounds, but I didn't have a chance to put it in.
I can help you if you want. I met with one of
Yeah,
our.
I'd love it. How do you do it?
Yeah, how did we do it? Let's see.
Just upload it, but you've got to be in
Okay,
the
so if
Zoom
you
app.
go on the bottom, you see where you have your settings.
Uh-huh.
So if you click settings and then you click at the top background.
Oh, wait, I don't see where I have the settings.
I don't either.
So like on the bottom where it says like chat, participants, Q&A, there's a little screw for settings.
Mine doesn't have that. I have interpretation and record, chat.
Try where it says video, stop video. There's like there's an arrow. If you click on that,
Okay. Yeah,
click on
I
video
got that.
settings.
Okay.
You can choose a virtual background or a video filter.
Okay, and one quick one, Stephanie.
Yes.
Usually we ask people to put themselves on English since we have interpretation. If everybody could click on the globe icon and put themselves on English.
Is that on the, where would I find that?
It's on the bottom of your Zoom screen, kind of to the right, Cheryl. It should be a
Oh,
red-
interpretation?
Yep, and then you click
Yeah, got it.
English.
Thank you.
And then do you mind if I ask a question of Louise?
Uh-huh.
Okay, so Louise, are you here? Are you in English with me? Okay. So we talked about having you join us and give a little direction about how to get the interpretation in Spanish. But one of our interpreters pointed out, but if they're already on the Spanish channel, then they don't get to hear the introduction. Will you interpret the introduction and then join us, or just stay on English and then go? Okay. Okay, that sounds perfect, because I understood that you.
Have any of you been aware of Charlene's programs, the Parent Venture, Parent Education programs that we've been running? The county has been, but Charlene's been doing it for some time with the Sequoia Healthcare District, County Office of Ed, and our healthcare district. If you haven't seen the flyers or the information, I'd love to put you on our mailing list, because she gets great speakers, good colleagues of yours, but from all over the United States. And the reason she generously took my "please could you help me" moderator task, because she does a marvelous job of having authors and speakers, but she gets the questions out and starts it on time and ends it on time. And then if you want to get a taste of what they're doing, she has Parent Venture has a whole archive video YouTube library of all of the programs that get videoed. And oh, look at you, got your background, Colleen. Wow, now I'm jealous.
Fancy. We should all probably have done that.
Thanks for your help,
Anyway,
Nicole.
would love to, just want to make you more aware of Charlene's a great moderator, but she also is, and her programs too, especially the virtual. I don't know how you worked before virtual. Did you do it before, or you met people? We did the coffee cafes and those type, but sometimes you have 400 signed up tonight, and you've had as many as 900. And
We did them in the performing arts centers, mostly in person, with food and tablecloths and flowers and the whole gig. But thank you. Yeah, the video library is free and open to the community. We have about close to 50,000 views now after 2 years of it. So that's good. And there's even a band of Spanish language programming that people are using.
Very neat.
We are excited about it.
well, I thought a plug was long overdue. So
Thank you, Cheryl. That's very kind. You are a wonderful partner.
anytime I don't have to do the moderating, I'm happy. I'm a happy camper.
Would you mind reminding us just kind of the beginning, kind of step by step, like how many minutes you want us roughly to kind of take introducing ourselves before we get into the questions?
Yes, good question, Nicole. So the first question that I'm going to ask you is this sort of stage setter. Please tell us a little bit about yourself and what role do you play in the fabric of services offered in San Mateo County. And I would take 3 minutes or so, 3 to 5 minutes for that. And then we're going to ask the other 3 or 4 core questions that you've already seen. Then we have a whole set of pre-questions that I wrote with my partner. And also Stephanie has sent a few that have come in to the Whova interface. Now, my guess is in the 30 or 40 minutes we have together, we probably won't get beyond those 5 or 6 questions. But I don't want you to rush, and at the same time, just keep an eye on the time. But I'd say 3 to 5 minutes for that first question, and then we'll go into How accessible are your services? And again, any question that I ask, you don't feel that you all need to answer, but whoever feels compelled to answer, okay? And just kind of like we practice in Anixa, you too, that question answers that are succinct and have an ending are really helpful.
Charlene, one question that I think kind of fell off the grid was the, how have you been, your services been impacted by COVID? I believe that was a question that was suggested.
Let's add that back on.
And ladies, I didn't introduce Stephanie Arevalo Rodriguez. Stephanie is our business operations manager for the healthcare district, and she is you know, on our little staff, she's as close as I have is to a tech department. So she wears many hats, but that's why I have my belt and Charlene to be the moderator and my suspenders and Stephanie to be the tech person. So I'm really glad, Steph, you could help us. This is a great way to spend our standing meeting time, huh?
So Stephanie, you also have the Whova app somewhere, like on your phone. Is that how you did it?
Yeah, I have it on my phone and I also have it here on my desktop. So I'm going to be monitoring from my phone and desktop, sending you any additional questions that come through. And then you will look at the questions that come through on Zoom, but I also have access to send those to you also.
Perfect, thank you.
Are we missing One Life? I thought we had a
We
clinician
do.
from
Oh
One Life.
yeah, there she is, Liz.
Liz is here. Yeah, all of our panelists are here.
Oh, I can't see Liz. Maybe I need to change my view.
Stephanie, do you want to make some of us
There we go.
co-hosts? Maybe me and Cheryl and
Yes, I made you co-host, Charlene, Louise, and I can make Cheryl co-host.
now, just so everybody knows though, they're not to touch the buttons. Only Stephanie is touching buttons that begin or end the session.
Yes. And once we start at 11, I will take myself off video. And that way I'm just, no one's distracted by me going back and forth with the computer and the phone, so.
We do mute and unmute ourselves, right? Or,
I think so.
okay.
I think so. I do typically.
Do you already have an order lined up of like the order of us kind of introducing ourselves for the 3 to 5 minutes?
Yeah, unfortunately I start.
So
I'm a little nervous.
Better you than me, Colleen.
You'll do great, Colleen. So it's sort of alphabetical by last name, as Cheryl said, no favorite playing here. So Colleen, Anixa, Nicole, and Liz.
Okay.
Everybody, are you okay with that? Speak now or forever hold your peace, as my mom would say. Yes? Okay. And Colleen, I'm going to make sure I've got your title right. Access Call Center Manager, Behavioral Health and Recovery. Oh, I don't need to have that services access line in there anymore, do I? No. No, never mind. I've got it.
I just want to mention, I just heard from Tanya, the session will open up to the attendees in 2 minutes. And that's when everyone will be able to see our live session, but we'll start promptly at 11.
So off-color jokes, is that what you're saying?
Yes.
Okay.
Are we raising our hands if we want to speak, or how will we let you know?
No, I'm going to just keep moving it between you all. So for each of these intros, I'll say, and now we're going to hear from Anixa, and now we're going to hear from Nicole, and finally Liz. And then I'll phrase a question, and then you all really can just jump in. At that point, all 4 of you will probably want to be unmuted because we really want this to be a conversation. So feel free to just do what you would do if you were all in a room. Yes, Cheryl?
Yeah.
It's a panel. It's a panel.
Yeah, yeah.
And we will save about 10 minutes at the end for questions. There may be some questions, there may be lots, there may be none, but I have a whole bunch of additional questions to ask. Nothing that you haven't seen before, okay? Just things like, do you recommend virtual therapy? What is your opinion about, you know, why it's still so hard to get care, sort of things that people have on their minds. Maybe a question about Spanish services, Liz, would that be appropriate? Okay, I think you're on mute.
Mhm.
Yeah, that would be good. I can.
And I want to acknowledge and thank Liz because shame on me for not thinking of it, but she said, will there be translation? And I thought, well, that wasn't on my radar screen, but then I know from Charlene's programs that she has a wonderful interpreter, and that's how all of this kind of happened. So I want to thank you for helping me see a duh.
Well, and we work with a whole array of interpreters, Cheryl, that come typically from the school districts. Luis is somebody that we met through the nonprofit Upward Scholars.
Okay, great. But now, Louise, you're going on a national speaker now.
Oh, yeah,
not
he's
to
gonna be
talk to you,
super
so
busy.
he may be on 60 Minutes in the future, so.
Yeah, you better
say
save some
you met
time
him
for
here.
us.
I do thank you all very much, because not only what you do, but your time, giving your time. Time's the most precious thing we have, especially when you've got an auditor. And then, you know, there's never enough hours in the day. So really know it, heartfelt. I appreciate it.
For those of you who have joined us already, I just want to say welcome. If you are here for what, where, why, and how navigating Bay Area mental health services, you are in the right workshop. We are going to be getting started here in just a couple of minutes. Again, welcome everyone as you're logging in. What is that noise? Anybody? Again, we want to welcome you as you're logging in today. We're going to be getting started here in just a couple of minutes. This workshop is what, where, why, and how navigating Bay Area mental health services. We are very glad you can join us today. We want to welcome, excuse me, want to welcome everyone who is here today. We're going to be getting started here promptly at 11. Thank you for joining us. Again, we'll be starting in just about 2 minutes, and we will be prompt. Again, starting in just about 1 minute. Well, hello, everyone. We want to welcome you to the RISE 2022 San Mateo County Women's Leadership Conference. We are so delighted that you can be with us today, especially for this important session, What, Where, Why, and How Navigating Bay Area Mental Health Services. We have with us a great panel today, and we're looking forward to a very enriching discussion on this really important topic, which, as you all know, could not be more timely. We have simultaneous Spanish interpretation today with Luis Romero. And if you would like Spanish, you'll click on the globe icon and Spanish. Luis, do you mind joining us to explain in Spanish? Thank you very much, Luis. Again, as I mentioned, today's session is an important one. What, where, how, why, and how navigating Bay Area mental health services. We have 4 professionals from the field joining us today. And for a few welcoming remarks, I would like to introduce Cheryl Fama, who is the CEO of the Peninsula Healthcare District. Cheryl.
Good morning. It's my honor to serve as the co-chair of the Mental Health Work Group for the Commission on the Status of Women. As a career-long healthcare professional, as well as a daughter, a mother, a grandmother, a wife, and a friend, I am acutely aware of the challenges we all face in maintaining our own behavioral wellness, and I know the feelings of inadequacy and fear when a loved one seems to need help and I'm just not sure where to go. We are most fortunate to have as our panelists 4 healthcare professionals representing 4 major mental health service providers for our community. Each has dedicated their professional lives to addressing those fears and needs. Thank you to our panelists for sharing your time and experience with our conference participants. Thank you to our audience. Please participate. Your questions are encouraged. And thank you to our moderator, Charlene. Let's get started.
Thank you so much, Cheryl. Again, my name is Charlene Margot, and I'm co-founder of nonprofit The Parent Venture and this program, the Parent Education Series. I am honored to be here today as your moderator for this session. We have 4 wonderful panelists, and I'll be telling you a little bit more about them. But first of all, a few housekeeping items. Today's session will be recorded and available to you through the Whova interface. So please do know that this is being recorded. It's a webinar format, so there's 2 ways for you, the participants, to engage with us. First of all, there's the chat button that many of you are familiar with. So in the chat, you will see resource links. Feel free to talk to one another or ask any sort of logistical questions of us. But we'd like you to put your questions for the panel in the Q&A button. So again, resource links, other communication in the chat, questions in the Q&A. We already have some great questions that had come in earlier for those of you who hopefully are on the line with us today. So we look forward to answering those questions. Our panelists today are Colleen Buggs, licensed clinical social worker, access call center manager from San Mateo County Health, Behavioral Health and Recovery Services. Next, we have Anixa Carmona, master's and EMHA, Administrative Director for Mental Health and Addiction Services at Sutter Health Mel's Peninsula Medical Center. Next on the panel, we have Nicole Ibarra, a licensed marriage and family therapist, who is the Area Director for Behavioral Health for Kaiser Permanente. Last but certainly not least, we have Liz Camarena West, who is an associate marriage and family therapist from One Life Counseling Center. We are honored to have such a distinguished panel with us today. And we're going to start out by asking them to introduce themselves. So Colleen, I'm going to start with you. Please tell us your name and a little bit more about what role you play in the fabric of services offered in San Mateo County.
Thank you, Charlene. Yeah, my name is Colleen. I'm the Access Call Center Manager for San Mateo County. The call center serves residents of San Mateo County who are uninsured, have Medi-Cal and other public insurances, and also help guide clients with private insurance and direct them to where they need mental health services or substance use services. We have a staff that answer phones and basically try to help connect, do warm handoff to different services in San Mateo County. We also receive referrals from primary care physicians, other therapists in the community, and just basically are the entry point for clients to get care.
Thank you so much, Colleen. Anixa, would you tell us a little bit about yourself and how your organization fits into the services offered in San Mateo County?
Good morning, and thank you, Charlene. So I am, again, Anixa Carmona. I'm very excited to be accompanied by such a wonderful group of women leaders in the mental health field in the area. Thanks for having me. I am the Administrative Director for Mental Health and Addiction Care at Sutter Health Mills Peninsula Medical Center. We have higher acuity levels, so part of the continuum of care for mental health, starting with the highest acuity level, which would be inpatient psychiatric services for adults and adolescents. Then also over the outpatient services, step down from inpatient services, which would be partial hospitalization program. It's an outpatient level of service, and the intensive outpatient program as well. This is for adults and as well as adolescents. So thank you for having me.
Thank you so much, Anixa. I appreciate that. Nicole, could you tell us a little bit about yourself and how your organization fits into the services in San Mateo County's sort of fabric of mental health services?
Absolutely, and thank you for the introduction, Charlene. It's a true honor to be here with all of you today. My name is Nicole Ibarra. I'm the area director for Kaiser for the psychiatry department. And we have two locations. We have a location in Redwood City as well as San Mateo, and we offer a wide variety and range of services. We serve Kaiser members, and I believe about 1 in 3 individuals in San Mateo County have Kaiser. So we serve those with psychiatric needs as well as addiction medicine recovery services. And we serve a wide variety of acuity levels. So we have outpatient therapy and group models for adults and for children. We also have intensive services for adults and for children. So we have an IOP program for adults and for youth, as well as EDIOP, which is eating disorder services. And we have an enhanced program for more of the mild to moderate. And we have an IOP track as well for more of the acute. We also have a triage program where we're constantly triaging either new members or members who have not had services from us in quite some time to make sure that we are able in the moment to triage their needs and assess what the next step and the next level of care will be for them. We also do all of the 5150 assessments for our emergency department as well through the triage center. And then we also have, we're considered an addiction medicine recovery services program level 1. There's other Kaiser locations that have level 2, which is more intensive for substance use. We're considered to be a level 1. And so all of our intensive services happen outside of the Redwood City clinic. And we also have a clinic in San Mateo, which is more of the outpatient for adults and for youth as well. We also have medical doctors, we have psychiatrists, we have nurses, we have medical assistants, dietitians who all support our team and wrap around the patients.
Thank you so much, Nicole. That was quite an array of services. Liz, would you introduce yourself and tell us more about your organization and how you fit into the mental health services fabric?
Thank you for the introduction, Charlene. Good morning, everyone. Thank you for having us. I'm here. My name is Liz Camarena West, and I'm here representing One Life Counseling Services. At One Life, we have a different range of services as well. We work in partnership with the school districts. We work in private practice, and we work with other partnerships such as Samaritan House, just to name some, Able Works, Paul, and others. Yeah.
Thank you so much, Liz. So here's a question that I think everybody probably can weigh in on. How accessible are your services, and how does one as a community member go about accessing them? Anybody to start?
I'm happy to start. The Access Call Center is open 24 hours a day. We have an after call service. We are, my team is staffed 8 to 5, and then we have a contract for evening and weekends. basically anybody looking for mental health services or substance use services that live in the county of San Mateo, we serve. So a call can come anytime. We have clinicians available. Our administrative staff will register, look into insurance, and see what options are there for clients.
Thank you so much, Colleen. I think, Nicole, you had something to add.
Yeah, so for Kaiser, you just need to call our department. We have receptionists who answer the phone during normal business hours, which is 8:30 a.m. to 5:30 p.m. And for any urgent needs after hours, the calls automatically get routed to our call center, where we have crisis therapists who are available for support. And our operator can connect patients as well. And so when patients call our clinic, it's really important that if this matter feels very urgent or feels like it is a crisis level, that is identified, so we can make sure that a triage therapist is available in that moment to connect right with the patient or with the family. But just by calling our department, you'll get connected and be able to start the process of getting connected to services.
Thank you so much, Nicole. Anixa, do you want to weigh in on how accessible are your services and how should one find them?
Absolutely. So for inpatient services, now this would be the highest acuity. This would be a crisis when the individual is in imminent danger to self or others. I think that at that point, a family member or even the individual themselves can go to the nearest emergency department facility. If it happens to be ours, we have a psychiatric emergency services within the emergency department where we have psychiatric nurses that complete the assessment to determine, do they meet criteria to be admitted onto an inpatient unit, or is the level of care needed a lower level of care to where we can refer for a future appointment to receive those services. We also have an intake department for those that are seeking outpatient services. Again, we don't have a traditional mental health care where it would be individual therapy or a 1 hour group a week. So we have more intensive services. When those are needed, it would be very appropriate to reach out to the intake line where we have individuals that are screening to determine appropriateness for level of care, and then they would be scheduled for a face-to-face assessment.
Thank you so much, Anixa. And Liz, how about you? How accessible are services at One Life Counseling Center, and how does one avail themselves of those services?
Yeah, so we offer services from private practice to insurance, such as Kaiser, also medical, BHRS, HBSM, and other programs that are offered for free to the public and pro bono. So we offer long-term psychotherapy and short-term psycho-brief therapy in Spanish and English.
Thank you so much, Liz. So now that there is so much focus on mental health, and I know as clinicians and support in mental health services, all of you are very experienced in this arena. How do we navigate services today? It seems that we're all hearing that the need is great, but there's just not enough services to go around. So the question is, and now that there's so much focus on mental health, how do we navigate this arena? Again, anybody.
I think it can feel really overwhelming, for folks to kind of start, especially if they have a loved one who's hurting or potentially, at risk for some self-harm or harm of others. And so I really suggest, at least for Kaiser, just reaching out and making that phone call and asking for help and raising your hand. I can't speak for other organizations, but for us, it's really just calling and starting that process. And just trusting. We have licensed therapists who will triage you, spend time with you. There's a very thorough assessment. It takes about 45 minutes to create, a really individualized treatment plan. So I think it just really involves, raising your hand and asking for help, especially if the need is pretty large.
Okay, thank you for that, Nicole. Anybody else, or we can move on to another question?
I just want to say pretty much similar to Nicole, I think it takes a lot of courage to ask for help. I think for a while, different priorities have taken over during the pandemic. And now's the time where people are starting to feel more symptoms and need more support. So yeah, it takes lots of courage and that kind of thing. But the good thing is, you know, in our county, we have people who will answer the phone, help direct, let you know about timelines, and just really be there to hear and support and help you get connected. So I think it's just having the ability to reach out and trust that there are services to help people out.
Thank you so much, Colleen. And for those of you who may have just joined us, the topic of this workshop is what, where, why, and how navigating Bay Area mental health services. So again, here is sort of the next logical question. How have your services been impacted by COVID? Anyone?
I can speak to it a little bit at the call center. I'm sorry. But we luckily had a IT team that could helped us a lot be able to work from home and have the ability for our therapists and psychiatrists at BHRS do what they need to do remotely and with telehealth. And we've seen that having the flexibility for clients to have the option now of coming in or having a telehealth appointment has resulted in less no-shows and different things. So there are some positive things that have come out around our system of being able to be more creative with working families, with individuals with transportation issues and that kind of thing. So we've been, it's impacted us to try to look at behavioral health differently. How do we meet the needs of clients when there are a lot of other pressing issues happening?
Thank you so much, Colleen. Nicole, looked like you had something to add.
Yeah, so for us, what we're noticing is we're receiving about 160 to 200 more calls per month than we received pre-pandemic, so in 2019. So we're seeing a significant increase of those who are needing support. Either new individuals who've never experienced depression and anxiety are starting to experience those symptoms. We also have returning patients who maybe were with us years ago and doing pretty well, and they've seen a return of their symptoms as well. So that's something that we're noticing. And I also agree with Colleen, there's been some silver linings. Before the pandemic, none of our services were virtual. And with the pandemic, that had to shift and really quickly. And we've gotten a lot of really positive responses, a lot of positive feedback. It's really important to us to really survey our patients right now, especially where we are in the pandemic, to see kind of where they're at as far as which groups or they would like to see return to in-person versus virtual, as well as individual therapy. I think everybody has different needs and wants. And I think even some people who were kind of against the virtual care are starting to embrace it and realizing, like, I don't have to drive an hour and a half through traffic after work, picking up my kid to get to those services where we can actually really connect, you know, one-on-one through video. So we've really changed the way that we've delivered care. There's been a lot of bumps in the road. But I'm really excited to just kind of see how this hybrid model develops, which we're currently working on. And we're able to see our patients in person for individual care right now, if that's their choice. So we're just really trying to pay attention to the choices of our patients, as everyone has unique needs.
Thank you so much, Nicole. And Anixa, how about Sutter Health, Mills Peninsula Medical Center? How has COVID impacted your services?
So I do echo what Colleen and Nicole shared. We also saw an increase on the demand for services. I think something positive that came out, like Nicole was sharing, was this hybrid model where we were able to increase access to services by providing the ability to do those virtual appointments. Something else I would say I started to see was even our healthcare workers started seeking services prior to reaching a crisis level. So people were more willing to seek services in a preventative kind of way before reaching that breaking point, and then were able to obtain those build a toolkit work with those symptoms and to be able to decrease those levels of symptomatology, so anxiety, those levels of depression, those levels of exhaustion before they reached that breaking point. So if we look at it, there was a silver lining with the pandemic, and I'm grateful for that.
Thank you, Anixa. That's the same thing we saw with parent education. We missed the in-person, but the access has increased in a way that's a real silver lining, isn't it? Liz, how about One Life? How has COVID impacted your services?
I think similar to what everybody's saying, there is a higher need for services, and also on the other hand, there has been more efforts to offer services for anyone. We have worked with partnerships to make services available for people, and these hybrid models that we have, from working over the phone that we didn't used to do it as often before, to telehealth, to now fortunately in person again. Yeah.
All right, thank you all. So as mental health professionals, we would like to know, for those of you who are in the workshop listening, what resources are available to the public from each of your organizations? Again, anybody should feel free to start, unless, Cheryl, did you have anything to say? No, okay.
I can share for Kaiser members. So, by calling and having your individual assessment to see, what your treatment plan will be, and if you meet medical necessity for therapy, for example, or more of an intensive service, those resources are absolutely available. And we have been developing more and more contracts with our community. So Liz, for example, from One Life, we're contracted with, we absolutely love working within the community. So we're expanding our contracts. That way we can serve more and more of our members. And we also have a behavioral health educational department for those who'd like to take more classes on depression and anxiety, need some support with sleep hygiene, etc. And Kaiser also developed a Calm app, which has been really popular for members, which has a bunch of different resources, guided meditations, grounding exercises, etc. And that's been a resource that's been really beneficial as well.
All right, thank you for that, Nicole. In general, do you feel that the pandemic has reduced stigma around mental health? We know that mental health organizations across the country are calling this a mental health crisis, especially for youth. So again, how do you think that the pandemic has impacted the stigma around mental health services?
I can start. I think that it definitely raised mental health to a higher awareness level. I think that there's still a lot of work to be done with stigma. I think that some of us do continue to feel a little embarrassed to talk about the need for mental health services, or thinking that if we seek mental health services, we're going to be judged or labeled. And so I think that yes, the conversation started. Yes, we have started working on decreasing the stigma and elevating awareness and normalizing and helping the community and the individuals understand that this is like any other medical issue, and that if we work on prevention and early intervention, we are going to be able to help future generations not go to that level, that crisis level, where then it's a little bit harder to turn around. So I think the more we talk about it, the more we have events like this one, the more we share what our personal experiences are with our family members, with community members, as speakers, the more we're going to be able to improve the mental health of our community.
Thank you so much, Anixa. Anybody else? It's such a good question. I really love your suggestion that the more we can increase upstream services, the more we can prevent problems in the future. Anybody else on the stigma around mental health? Yes, Nicole.
Yeah. So we've noticed, huge improvements. I think there's always room for continued efforts, but huge improvements with reducing the stigma. To answer your question about what we've observed, especially with children, is that many children, I think at the beginning of the pandemic, maybe were relieved to be home because it kind of alleviated some of that social anxiety, for example, maybe reduced some of the bullying that was going on with having them home and not in schools. And we noticed as kids started returning to schools that our numbers for child consults went up and up and up because they had to start kind of facing some of those issues again in their schools. And we also noticed that children, who were experiencing trauma in the household, that we were noticing an increase in those calls as well, because school kind of happened to be their safe place where they could go, during the day. And then when they were home 24/7, there was an increase in the trauma that was happening. So those are some observations that we had. We had more kind of kiddos in our intensive service program for a while during the pandemic. And then as kids were transitioning back to the classroom, we just noticed a huge spike in our census as well.
All right, anyone else who would like to address this question of stigma around mental health?
Yeah, sorry, go ahead, Colleen.
No, go ahead, Liz.
Yes, at One Life we have also increased the efforts to go and do psychoeducation for the Hispanic community as well. Unfortunately, with the pandemic, we have seen more grief, more trauma, more anxiety. So like as Anixa was saying, normalizing that we are going through these things and making ourselves available to talk about these topics, that is very important. Like virtually now virtual, but going into communities and talking about these topics openly.
All right, thank you, Anixa. Colleen, you have something to add. Thank you.
I was just going to add for behavioral health and recovery services outside of the Access Call Center, but as a whole, we had in the beginning of the pandemic, we had town halls where we had people outreach to the community to find out what the needs were in terms of how to get connected. And those meetings brought a lot of insight into what people needed to reduce stigma and to access care. So there were a lot of outreach attempts to make sure we're still keeping connected. But I ditto everything that everybody else shared. It's really just role modeling and talking about behavioral health in a way that we talk about primary care and going to the doctor. For a long time, it's been seen that behavioral health is something that you don't really need to check in about regularly and that kind of thing. So there has been a lot of work that's happened where when people visit the doctor, when people go to school, just asking about it and modeling that it's just as important as any other part of your health is to check in about your anxiety, your depression, your other symptoms, and hopefully getting support before it becomes a crisis really reduces stigma. So it's really just changing that piece where only certain people need behavioral health. Everybody needs it, just like everybody needs to go to primary care and have a check-in.
Thank you, Colleen. Really great answer. So one of the questions that we've gotten is, in some cultures, seeking mental health services is not so acceptable. People worried about being judged by friends or family members. Can you comment on that particular stigma around a cultural non-acceptance of seeking help for mental health issues? Anybody? Liz, is this someone you want to take?
Yeah, so would you please repeat the question again?
Yes. Pardon me. The question is, in some cultures, seeking mental health outside the home is really not acceptable. Would you say that that is still an issue? And if so, how would you advise people who are worried about whether they'll be judged by their friends or family?
Right. I think there has been also a change on being open about requesting services from, speaking on behalf of the Hispanic community. Just knowing that the services that you're gonna get, the psychotherapy that you're gonna get is going to be confidential. So you don't really need to share it if you don't feel comfortable with that. If you feel comfortable with sharing it and open about it, I think that also could help others to reach out and request services. But if it's something that you want to keep private, you're totally welcome to just address the needs that you have, and then you don't need to be open about it if you don't feel comfortable. Yeah.
So do you think do you think there's been a shift amongst cultures for whom it has not been acceptable in the past? I know One Life Counseling Centers does a wonderful job with your outreach to the community.
I think there's been somewhat of a shift with accessibility, and that goes along with the telehealth too. But people sometimes don't want to enter a place where they know they're going to a behavioral health facility. Sometimes, there's always going to be a stigma. Unfortunately, we have a culture that uses offensive words or, just really kind of talk about mental health in a way that's not positive. But more and more of the media and more flexibility around how to get to appointments or how to have appointments, I think has helped where people can do it more confidentially and work it around what they're doing. So there have been improvements, but I think there's still a long way to go. And that goes along with, cultural humility and really making services applicable to communities that have been underserved and making sure the right people are providing those services so people feel safe and see their community providing that service.
I think that's a really good point. Thank you, Colleen. When my own daughter was in high school, the mental health organization was in a trailer in the parking lot. So everybody would watch the kids walk out to the trailer, and that was very stigmatizing for a lot of the kids. Yeah, I can see, Liz, you agree with that. So here's the question that we get a lot from people, and it's a tricky one. With the need so high for mental health services, we hear that it's still hard to find a therapist. What should a parent or caregiver do if they have a child or teen in urgent need of mental health services? Anybody?
I mean, as a parent myself, I think we have to be our kids' biggest advocate, right? And I think sometimes it's hard to put into words what your loved one is experiencing or feeling. But I think just using that appropriate language, and even if you are kind of really struggling with what they're going through, being able to communicate the severity of it is critical, because that can make a big difference as far as you kind of getting lumped into the more mild to moderate versus acute to severe. And even if you're just questioning the urgency, I think you have to say that this feels urgent. I'm not quite sure if my child is at risk for harming themselves, but they're making these scary statements, right? Really being able to kind of vocalize the observations and the symptoms that are affecting them, so that way you can get that help as soon as possible.
All right, thank you for that. Nicole, anybody else who wants to weigh in on this sense that it's just really hard to find a therapist? There aren't enough to go around. You all really talked about people being able to just call your centers and get help. Is this perhaps sort of an urban myth that it's hard to find somebody? Can anybody comment?
Yeah, I think there is a myth to it. I think what's hard is people have complicated lives, right? So you make the time to try to call, and especially families, you make the time to try to call and get services, and then oftentimes a lot of other things happen. And so linking to care and trying to do it as quick as possible is very important, and setting expectations. So as anybody getting services, but especially a parent, just ask those questions like, when will I get the name of a therapist? What are the next steps? Can you work around my child's schedule? I'm working between this time and that time. Is there a better time, that you can talk to someone and have them call back, a lunch break or that kind of thing. But I do think it's somewhat of a myth. We always could use more providers, but I've, at least through the call center, I don't see that it's ever more than a few weeks that we can get a person connected to care. But it is a lot about finding that time to follow through and making sure you let people know what your needs are around how urgent the appointment is, like Nicole said.
So here's a question that has come in from our audience. Let me see what you think about this. Attendee asks, how would you handle a situation that's at a middle point from non-crisis to crisis level, meaning that the case might not have, it's not a crisis level, but again, it's sort of a middle level problem. Will they still be able to get services?
Definitely. I think those services are available and probably the best time to get services is when you have not very many symptoms and to still ask for services, and most benefits will still cover it. And it's better to do that before it becomes more moderate or severe. But if you're in a moderate situation, or you have a family member or a friend, we always say like protective factors are super important. So really kind of making sure there are other people in the family or friends touching base and being there as you wait for services or that kind of thing. But
Yeah, so for us, oh, I'm so sorry, you go ahead.
So something that I have, it doesn't matter where I've worked throughout the years. I've been in mental health now for 18 years. All the different organizations that I've worked in, a couple of things that I believe are underutilized are the employee assistance program. Most employers do have employee assistance program where there are free sessions that are provided to the employee, the spouse, significant other, children, family members, and that is very, very underutilized. They provide, you can access it right away. They connect to additional services if additional sessions are needed. So that is one area that I would strongly encourage people to tap into. And then most insurance companies or insurance plans do have care coordinators in this day and age that are in touch with mental health services as well, that will listen to the crisis and recommend this is what you need to do, this is where you need to be calling, this service will be covered. So I think those two things, and they will provide the names. They will look at a zip code, they will reach out to the provider themselves and connect us to those services. So I think those two areas should also be considered for any crisis level.
So here's a question that just came in again from one of our attendees. She asks, finding mental health services for a close family member of mine has been extremely challenging because of long waiting lists. Also, lots of providers are not taking on new patients. My family needs therapy due to emotional trauma, PTSD, and social anxiety, and finding that specialized professional has been very hard. Any suggestions? Like, who should somebody call? Just what do you think about this question?
I think it
do want to
depends on.
validate that yes, it is hard. It is hard. I know that I have checked in with colleagues in other states, and this is countrywide, especially after the pandemic. I believe there's a shortage of providers, individual therapy providers in the communities. I think that, again, going back to the insurance provider, there's also websites such as Psychology Today that we can take a look at, and you can actually read the bio and the specialty of the different therapists, the areas where they're in that we can look into. So those are a couple of the things that I would suggest we do.
You know, you bring up, oh, I'm sorry, go ahead.
oh,
Was someone trying to speak? I'm sorry. Okay, related question. We get this question a lot, including today. What about criteria for finding a therapist or good fit? Should you look at gender, race, ethnicity when you're trying to find a therapist? What do you suggest about really, whether it's for you or your child? What do you recommend in terms of criteria? In this day and age, should you have criteria? Again, anyway.
I think if some situations and there's some trauma that people experience that they really need to ask for a specific provider, or, but generally speaking, it's about the relationship. So, really trying to have an open mind and waiting to have that appointment and being open to it. The person who helps you might be the person you least expect to provide that service, but really honoring people's personal experience in trauma is also important. And system oppression and different things where people are gonna feel more safe with a specific provider.
Yeah, I really agree with what Colleen just mentioned. For myself, before I got into management, I often connected the most with patients who came from completely different walks of life and backgrounds than I had. And I think sometimes we do connect when we least expect it. Like I had a patient recently who had a very specific criteria for the therapist that she wanted, and I was able to find that. But in the meantime, she was meeting with a different therapist that didn't necessarily fit that criteria. And she ended up changing her mind because she built this relationship that was kind of unexpected and was really getting her treatment goals met. So I think, it's a really individualized kind of decision. And I think it is okay to say what it is that you think you feel you need, but also being just kind of keeping an open mind as well. And also just realizing that organizations are working really hard to, increase the amount of services that we have and therapists in the workforce. Like for us, we are noticing a huge shortage in therapists, statewide. And I think it's important to really admit that. But we're coming up with creative ideas. Like we have a mental health scholars program that supports members of our own workforce who want to become mental health clinicians. And we're working really hard to make sure that there's diversity in our staff so that it represents the populations that we're working. So there is more of a variety for our patients to work with.
So you're saying that it may be okay to have a criteria, but you may surprise yourself by finding someone who is different than what you expected. Is that what you're saying, Nicole?
Yeah, I see that happen all the time. I really do.
Okay. What should you do if your child says they don't like their therapist, especially after you've spent a lot of time finding someone? Should you honor that, or should you say, gosh, let's just stick it out for a while? What would be the best thing for a parent to do?
I think there's always value in trying to see if there could be a reparative experience to the therapeutic relationship. But also if your gut's telling you it's not a good fit, I think it's okay to speak up about that, right? Like if we went shopping for jeans, would go for a different size, fit, style, etc. So we all have different unique needs. I think if it's really not working and it's a matter of your kid getting support and services or being turned on or turned off, then it's okay to speak up and say, we'd like to go in a different direction and maybe try somebody else.
Okay, so you really have to understand your child and see whether that is something to consider in making a change.
And are they improving or not, right? If their symptoms are not improving and it's been a significant amount of time, then I think it's absolutely okay to advocate. I get calls daily around, requests for a change, or can we go in a different direction or try something new? And we're very flexible and open with that.
Okay. So here's a question. I am pretty certain that I know how you all will answer, but I really want to hear your professional opinion. Is telehealth here to stay? Online services, texting, Zoom, virtual therapy. Do you think we will continue even after, and hopefully if the pandemic winds down? Is there a preference for in-person, or do you really think that virtual, for example, may have advantages for teenagers?
I think hybrid is going to be the way that we have to go. I think we need to be able to offer both. And I think telehealth is here to stay, but we also have to be really mindful of our patients to make sure that they're able to access telehealth in the way that they need to, and offer both array of services, a menu, right? If we walked into a restaurant, we wouldn't all order the same item. And I think that's the same when it comes to getting care as well. I get calls all the time of patients who are absolutely refusing to try virtual. Some are somewhat open to it, but we got to meet them where they're at, because they're raising their hand and they're asking for help in that moment. So I think having the option of both is really going to be the way that we're going to be successful moving forward.
Yeah, I would also add, in terms of the hybrid model, I think it's also, we've all learned how to be home and have everything kind of virtual, and there is definitely a benefit to connection, right? And being able to, if you do have virtual, having the hybrid model be that, you still see your therapist once in a while, face to face, and that you live locally, and make sure that you can have that relationship some of the time in person, or work out different creative ways. But the hybrid model it helps with access. So it's a matter of sorting out the individual needs, like Nicole was sharing.
Thank you for that, Colleen. What about a person who is very private and has never tried mental health services? What advice would you give to someone like that who may be worried that for themselves or their child, seeking mental health may impact friends, the school? Some people are very concerned about the privacy element. Could you comment on that? Anybody?
I can speak again. I think that that's a really normal experience. I think most people have a hard time of how do you start that conversation? How do you build a relationship with a stranger about your most, private parts of your life and feel safe? I think it's like anything else where you're trying it new, just to slowly get comfortable and be open to it, but recognize that it would be odd if you didn't have that feeling. It's entering a new relationship and a new situation that you've not been in before. Even if you've been in therapy multiple times, that first time you go and talk about a new issue or something going on, or the experience of what is my child going to talk about when I'm not there? All of those things are so normal. So just kind of normalizing it for yourself.
Thank you, Colleen. I think that's really good advice, looking on this as you would with any kind of new relationship. So should parents be worried about, if they seek services for their child, any backlash from the schools? How confidential is it if you go to Kaiser or you go to San Mateo County Behavioral Health to get services? Will schools be notified, for example? That's a very newbie question, but I'm going to ask it.
It's extremely confidential. We take PHI, protected health information, extremely seriously, and uphold all of the responsibilities when it comes to confidentiality. That's critical for us.
Okay, thank you. I think that
I would just add, there are everybody does have to mandatory report if there's abuse or neglect, and those are the very rare, and but we want to make sure children are safe, and elders are safe as well. So there are certain rules we have to go by as clinicians, but generally speaking, 99% of everything is kept confidential. And you can always ask your therapist, what are those, what do you have to mandatory report, and and learn more about it, so that you feel more safe.
Thank you for that, Colleen. So parents should not be afraid to ask questions.
No, and oftentimes parents sometimes want the involvement of the mental health provider, right? Like if their child is going through like an IEP assessment, for example, it may be extremely helpful to have the psychiatrist or the therapist kind of share an assessment document, for example. So we see that a lot as well. The two can kind of go hand in hand.
Okay. So we have now reached the part of the program where we really want to hear from you, our attendees. So we're going to open it up to questions from you, the audience. We've already had some great questions coming in, but if you have questions that you would like our distinguished panelists to answer, please type them into the Q&A. So Q&A button for questions. We now have about 10 minutes for questions from the audience before we wrap up with a final question from you panelists. So here's a question that's just come in. This is an interesting thought. She says, the demand for emotional support is higher than ever before due to the pandemic and openness of people to seek help. How can we also contribute to meet that demand as individuals trying to give back to our community? I think about Liz, for example, all that One Life has done in supporting the community with food and clothing. What do you suggest for people who want to support mental health services in San Mateo County as someone who wants to give back to the community? Any ideas? I think it's a great question.
I think there's such a wide variety of things you can do. You can get involved with a board, you can volunteer, right? There's NAMI, which is a fantastic resource for families in the community with mental health. You can volunteer or become a part of. So I think it kind of depends on the level of involvement, but I think just through connection. And I think that's been a huge hugely missed, at least in our department through the pandemic, as we were used to connecting with potlucks and gatherings and holiday, events. And so for a lot of our new staff who've joined in this virtual world, it's like we kind of just become this box to one another. So I think just finding really creative ways to connect with individuals and to embrace, different mental health organizations and providers and just get involved.
Thank you for that. And Nicole, there's a quick question for here. Maybe you could answer from an audience member. How does an organization get contracted with Kaiser?
Yeah, so I would be happy to connect offline. I'll send my direct desk phone number. So one thing we're really excited about is rather than us just referring out to other organizations like we used to, and having patients have to call all of these different lists to see if therapists are full or taking new patients, we have a new way of referring to therapists in the community through KP Direct. It's a new booking system where, for example, I can book a patient with a first appointment based on your availability. You as the provider put your availability in the KP Direct system, and I can book that first appointment, which serves as a referral. So we'd want to get you connected with our KP Direct team if you wanted to contract with us as an individual provider. If a network, it would be a slightly different approach, like with One Life, for example, but I'm happy to connect you to the right people. So I will put my direct phone number in the chat and feel free to give me a call.
Thank you, Nicole. And also attendees, I would like to call your attention to the chat. Nicole and Anixa have also put in contact phone numbers that you can call if you need help. Liz has put in a link and phone number for One Life Counseling Services. So again, do check the chat for some direct resources. Really great information there for you. All right, another question back to schools for a minute, because this is, of course, top of mind for many parents in San Mateo County. Question: how do you navigate mental health resources for kids or students in school? Many times schools do not have enough resources and the kids end up not getting enough help. This is a crisis and needs to be resolved, but don't know what to do. I know none of you are direct school services providers, but if anyone could touch on that.
I can speak a little bit about that. I work at a different couple of schools in Redwood City, and I can say that we offer brief therapy, 8 to 10 sessions. There is also always the possibility of having a check-in if you're worried about your child, your son or your daughter. And then as a parent, I think you are completely you can request for a referral out if you feel like there is more need aside from what the school offers with the counselors there. If you can request an IEP if there is a specific needs that you need to address for the education of your child. But yeah, you can ask for a referral out if that's what you would like.
Thank you for that, Liz. Cheryl.
Charlene, I'm not a panelist, but I'd like to just speak to Care Solace. Between a partnership between the County Office of Ed and the 2 healthcare districts, we've partnered together to make available to every K-8 school district throughout the county of San Mateo access to this service. And each school has a phone number. It's a private phone number, and it's available to every student, parent, adult living in the household, sibling, teacher. If they're just feeling like they could need help, to just call the number from the school. It's all confidential, and they help to triage and to help link with services. So I just couldn't be quiet about that, because we're proud of that. It's available, and what we're proud of is it's available to all by a phone call. It doesn't require access to the internet. It's confidential. And then what they do is hook folks up with, should they need services, with the right insurance plan, with culturally sensitive, with geographic, as they determine the needs. They do not treat, but they do help to expedite up to and including beyond a warm handoff, actually making the appointment. So Care Solace, if you're a parent out there, check with your school district office. So thank you.
Thank you, Cheryl. And again, Care Solace is available now throughout San Mateo County. Is that right? Okay. All right. Oh, and thank you, Stephanie has just dropped that link into the chat. Again, we have other links, resource links, so do check that for the organizations here. All right, we have time for one more audience question, and then I'm going to ask sort of a final wrap-up question of our panelists. Parent asks here, while seeking care for my daughter, both as a child and a disabled adult, calling list of providers, I found that most are not taking new clients or not accepting insurance. Even the BHRS clients with most severe mental health conditions are not necessarily having access to a therapist. This is not an urban myth. So again, people are still struggling. Any advice from you professionals when you hear a comment like that?
I would say perhaps exploring what other resources are available. If BHRS or others right now have a wait list that it's like what we are all experiencing, having wait lists. There are community centers that offer services as well. So perhaps a brief therapy while you get into the other services.
That's a good suggestion, Liz. Anybody else?
Yeah, I would definitely recommend people to, you know, if you're running into challenges, there's never an issue with a grievance or a challenge, you know, letting people know when you're not able to have your, you know, have your benefits or your rights of getting services. You know, there are ways where we inform the system, right? If things are not going the way we need to. If also being patient and, like Liz said, looking into other resources, but you have rights and you have benefits, and it's really challenging in San Mateo County. We have a lot of therapists that only take private pay because it's really difficult to live on insurance. And so some of the things we really are trying to fix as a system, but it is challenging.
Thank you for that, Colleen. All right, we have a few minutes left together, panelists, literally about 3 minutes. I would like each of you to take 30 seconds and, in your opinion, give us one key takeaway from today. What do you most want our attendees today to know? I'm not going to put you on the spot, but I'm going to anyway. Anixa, starting with you.
Yeah, so I would say continue to be an advocate for yourself and for your family member, your child. Continue to do research, continue to speak up about mental health and the mental health needs, and let's continue working on reducing that stigma around mental health.
Thank you, Anixa. Wonderful final comments. Nicole, how about you?
Yeah, I would say, you know, just make sure that you raise your hand and ask for help, or you help your loved one in a moment where they're expressing that they're going through some difficulty. And also just know that providers are really trying to, you know, shift the way that we're providing services. Like we're developing much more like specialized treatment tracks for individuals. So there's a lot that's happening in the world of mental health that's really exciting. And I know that, you know, there's definitely difficulties getting connected, but just know that you can always, you know, call me, for example, if you're having difficulty getting connected with Kaiser. I put my direct phone number right here, and I don't leave for the day until I've returned all of my voicemails. So just reach out and ask for help. If you're having difficulty, we're here for you.
You're going to get some calls, Nicole. Liz, how about you? A final takeaway.
I just can't say, you know, how there are wonderful organizations that are available to offer services, and that can also look like a support group. If that's something that you would like to, you know, join others and talk about things that you have in common with others as well. So reach out. There are a lot of organizations doing an excellent work, and services are available in different ways.
Thank you so much, Liz. Really great comments. Colleen, how about you?
Yeah, one takeaway for me is just normalizing behavioral health and mental health, and really being open to the fact that everybody right now needs support. We've all been through a very major change and continue to be. So on an individual basis, being compassionate that, you know, some organizations can't help but be short-staffed right now. Compassion when you're going to the store. Everybody has their own story. And we've all been through a lot together. So just kind of keeping that in mind and lowering the stigma and paying attention if someone's asking for help, handing over a resource and helping them feel more motivated about it, lowering the stigma.
Thank you, Colleen. And Cheryl Fama, as commissioner for this conference, I'm going to give you the last word.
Thank you to the panelists. Thank you for the attendees with their great questions. Thank you for all of us saying the same thing and hoping for the same thing, and that is, let's break down the stigma. Let's not be afraid to remember I love the old saying, we've all got to put our oxygen on first. So take care of yourselves, and don't be afraid to raise your hand, and don't be afraid to take advantage of some of these connections that we've offered you today. And on the take care of your health, please sign in for the 3 o'clock session that our code team on mental health is providing. 3 o'clock, we're going to do some relaxing yoga and then have some nice discussion on evidence-based treatment and how you can keep your own behavioral health where you want it. So thank you. And thank you, Charlene, and all of you.
Thank you so much, Cheryl. Many thanks to Colleen Buggs, Anixa Carmona, Nicole Ibarra, and Liz Camarena West. Take care, everyone. Enjoy the rest of your conference. Goodbye.
Thank you for having us. Appreciate it.
Thank you, everyone.
Thank you so much.
Stephanie, I'm going to let you end the session.